Is there an easier way to do treatment plans? This is this really common question I get, especially when we're talking about electronic health records, or commonly referred to as EHRs. Hi, I'm Dr. Maelisa McCaffrey, founder of the free private practice paperwork crash course, and today I'm going to give you some tips on treatment planning within your EHR. Let's save you some time. Okay, the first rule is just because there's a treatment planning section inside your EHR, that doesn't mean you have to use it. Your licensing board didn't create that. Your ethics committee didn't make that up, okay? Some program developer did. There's no insurance company that is like, oh, only use this EHR because we like that treatment plan. No, doesn't exist. So that gives you flexibility to use what you want. Now, yes, certain EHRs are going to limit you, meaning maybe it's a required field. So for example, a common thing that is in a lot of EHR treatment plans is a section called symptoms or diagnosis or treatment summary or something like that, where they want you to put in diagnostic criteria. But guess what? You've probably already written that somewhere else within the client's record, right? So maybe on their progress note, maybe within their intake assessment. And let me give you a bonus tip. This is one of my #1 rules that applies 100% of the time. Never write anything twice. So if you already wrote a summary of those symptoms in that intake progress note, guess what you can put in that EHR treatment plan? See intake note. See intake assessment. Not applicable. Any of those are totally fine. So just because there's a section inside the treatment plan for your EHR, it doesn't mean you have to fill it out. Now I know, because you're a high achiever, you have at least a master's degree if you're a therapist, and so you feel compelled to fill in all of those little sections. So this is me giving you permission to say, not applicable. NA, see intake note, see intake assessment. One of those options is going to fit a lot of the time. So if you've ever written that information elsewhere in the client record, do not write it in your treatment plan. Not worth your time. Now I say this as the #1 thing because for most electronic health records, the way that they set up the treatment plan is different from the way they would set up what would traditionally be other forms, like informed consent or progress notes. So because of that, it's embedded within the system and it's not a form that you can adapt to yourself. It's not something that you can tweak like you maybe would with a progress note template. So that's not ideal, but it's perfectly fine. We can work with it. So the other thing that most electronic health records do within their treatment plans that drives me insane is that they have goals and objectives. Now here's the thing. I used to teach people how to do this within large agencies with Medicare and Medicaid requirements, and guess what? We didn't use goals and objectives. We just used one because they're the same thing. So only use one. So let's see, if your treatment plan is set up goal #1, and then it has objective #1, objective #2, and then goal #2, objective #1, objective #2. Again, pick and choose which sections you want to use. I recommend just use the goals. It's easier, but within your EHR, you want to see, how does that adapt to the note? For example, a lot of times the main goal will actually populate into a progress note. So you want to make sure you're using what your system is set up to use. So if that's the case, I recommend just use the goals, and the objective sections, leave it blank or put NA. You don't need it. Goals and objectives are the same thing. So there we go. We just cut your treatment plan in half. And since I know you're going to ask and you're wondering this right now, how many goals do I need? I would say 2 to 3 for most clients. Anything other than that, and it's really not something you can realistically work on with people in a 6 to 12 month time frame. So just do 2 to 3 goals, leave the objectives blank, and then complete the rest. So just doing that should make writing your treatment plan a lot easier, a lot simpler. Now, if you want more help with treatment plans, you can check out some of the free videos. We will link to those here. Or you can also check out the free private practice paperwork crash course, where I do walk you through some of the basics of writing a treatment plan and what you want to have. So check it out and let's get those treatment plans simplified.